Happy Wednesday Wellness, everybody.
Happy Wednesday. We are going to answer the age-old question.
Do chiropractors turn babies?
Do chiropractors turn babies? Why are people coming to us with a Breech baby?
Yeah. And the answer is it's complicated.
It's kind of we actually don't turn a baby, and ECV does that. But
yeah. So what we do is just helping the pelvis be in good alignment, helping give the baby best amount of space. And so we'll go over
all that.
What Webster technique is.
Webster technique. This is the pelvis.
Yay.
This is where baby is housed in the pelvis.
Yep.
This is where baby's going to exit the pelvis.
Exactly. Yep. And so you can see it's like a nice round pelvic opening here. And if things are out of alignment, if pelvis is like rotated or stuck, not only does it change the shape down here, but like this isn't just a dry spine, right? Imagine like all the pelvic floor muscles down here. We have our uterus sitting in here. So when this is out of alignment, your uterus is going to sit in a different position. Those ligaments are going to be really tight, and all those muscles are going to be really tight too. So not only does it change the shape of the pelvis, but it also changes the tension in the muscles and the ligaments and all that too. So creates just a more difficult area for baby to go through, or for baby to get into good position.
To get in good position, yes. Yeah. So if someone calls us and they're like, my baby's breech, what are we, like, can you help? Mm-hmm. We're like, well, we can help align your pelvis, as you said, right? Yep. And we do that using the Webster technique. Dr. Annie and I are both Webster certified. Mm-hmm. Pretty much that's an analysis of the pelvis.
Exactly. It's looking for like that.
Yeah, what's going on with it.
Exactly, yeah, that misalignment.
What's going on with it. And usually there's something going on with it. Most people, especially if you have a breech baby, or like you said, maybe they have really tight pelvic floor, don't have a perfectly aligned pelvis. Mm-hmm. So see what's going on with that. Adjust it. Make sure everything is well aligned. But then we also work, I think you were just talking about, we work on the round ligaments. We work on the psoas muscles. We're working on piriformis muscles. We might do different stretches to get pelvis nice and balanced.
All the muscles.
Nice, we are like seeing like, hey, it's like even like what direction is uterus going in? Like, if your pelvis is misaligned, like as you said, right? Like uterus can't be in best position, so baby can't get in best position.
Exactly. That creates interuterine tension, right? Which can affect how much room baby has to grow, where the placenta is. Like all of that is going to be affected by like the uterine position too, which is affected by the pelvis position.
And I'd say the big thing would be like when you find out baby is breech, I'd say call then. Yeah. Most OBs, midwives, they're not really concerned about it until 36 weeks. And then we get a call at 36 weeks. And that doesn't give us enough time always. Like, there might be a lot going on.
Baby's already really big at that point. Yeah. Yeah. And like, they're taking up a lot of space. So you're usually pretty uncomfortable.
Yeah. So if you find out at 27 weeks or whatever, it's like a good time to call then. So we can start the work then and hopefully get baby to move. Like get your body balanced so baby can get in best position.
Especially, like, if you already know, like, I feel like a lot of women know if they're like, one leg keeps falling asleep. One leg, I get sciatica on one side. I get, like...
If you're having round ligament pain, you're having pubic bone pain, if you're having sciatica, if you're having low back pain, okay, then things are out of place.
Exactly, yeah. And so those are all factors kind of leading up to it, too. If you have, like, a tight or weak pelvic floor, that can also be a factor in, like, that pelvic misalignment, too. So, again, like... getting those things checked, but as soon as you find out baby's breech, that's a great time to get in because there's so much that we can do as early as possible just to help get that back into alignment, restore that communication in those nerves, in the uterus, in the muscles and everything too, so that you have the best chance of baby getting into the right position. Yeah. We have the best chance of having just like a good smooth labor.
A natural vaginal delivery you may want. Yeah, because no one like really necessarily wants to go into surgery if they don't have to.
Exactly.
Yeah. So like I said, like we'd like to help you early. We're not moving baby, we're just helping your body be in better alignment.
Yep, and giving them the best chance. And so even if you're thinking of an ECV and you're like, well, somebody's going to move that baby anyways, this is a great precursor to that because we get your body as ready as possible. And then if babies still can't flip on their own, usually there's another reason going on, like a nuchal cord or like just the anatomical shape of the pelvis or the uterus. But sometimes the ECV still can be successful after doing this work. Think about it. But it's so much easier on the body,
if your pelvis is balanced and those muscles are balanced, it makes it a lot easier.
Exactly. So it's great supportive.
So we've seen both. We've seen it like, oh, baby flipped on own, great, after being under care. Then we've seen it like, okay, they still had to do the ECV, and then the ECV was successful.
Exactly.
So,
yep.
It's great. So yeah, so if you have a breech baby or know someone who does, you can send them this video.
Or if you're early in pregnancy and you're like,
you should come in anyways.
I don't want to worry about having a breech baby. Or if you're late in pregnancy and
you're uncomfortable and you just realize, like, oh, maybe I should get under care.
You want to make sure your pelvis is in alignment.
We'll see you at any time, but starting the earlier the better. Mm-hmm. You get people that start at like 5 weeks. But as soon as they find out.
Oh, yeah.
It's great. Okay. All right. Have a great day.
Happy Wednesday.